Hello, my name is Vanessa Garcia and I'm going to present you the menstrual cycle. About once a month, females who have been through puberty will experience menstrual bleeding. This happens because the lining of the uterus has prepared itself for a possible pregnancy by becoming thicker and richer in a blood vessel. Pregnancy does not occur, this thinker lining is thrown off, accompanied by bleeding. Bleeding usually lasts for 8 to 3 days. For most women, menstruation happens in a fairly regular, predictable pattern. The length of time from the first day of one period to the first day of the next period normally range for 21 to 35 days. Day 1 to 5. When the bleeding starts, your period can last anywhere from 3 to 8 days. Bleeding is usually heaviest on the first 2 days. Day 6 to 14. Once the bleeding stops, the uterine lining begins to prepare for a possible of pregnancy. The uterine lining becomes thicker and enriches in blood and nutrients. Day 14 to 25. Somewhere around day 14, an egg is released from one of the ovaries and begins its journey down the fallopian tubes to the uterus. If sperm are present in the fallopian tubes at this time, fertilization can occur. Day 25 to 28. If the egg was not fertilized or implantation does not occur, hormonal change signal the uterus to prepare to shed its lining, and the egg breaks down and is shed along with lining. The cycle begins again on day 1 menstrual bleeding. The menstrual cycle is regulated by hormones, luteinizing hormone and follicle-stimulating hormone, which are produced by the pituitary gland, promote ovulation and stimulates the ovaries to produce estrogen and progesterone. Estrogen and progesterone stimulate the uterus and breaks to prepare for possible fertilization.
Well, hi, my name is Vanessa Alvarez, and I'm going to talk about the anticonceptive methods to avoid pregnancy. I'm going to talk about the physical methods. They are divided into the barrier methods, the intrauterine device, that is the IUD, and finally, the surgical sterilization. First, I'm going to talk about the barrier methods. These ones are in charge of prevent the sperm from entering the vagina or the uterus. These types of anticonceptive methods are the condom, the female condom, and the diaphragm. First, we have the normal condom. This is a latex covering that must be placed over the penis and when it's erected, and obviously before penetration. Then we have the female condom. This one is always like a vaginal sac. It has 2 rings as it ends, and this one should cover the cervix, and the other one the external genitalia. Finally, we have the diaphragm. It's a cup-shaped gum that adapts to the cervix. And remember, all of these ones are barrier methods. Some indications are that they must not be placed at hot weather, and they must be taken into consideration their expiry date. Then we have the intrauterine device, the IUD, in Spanish DIU. This device is placed inside the uterus of the woman, and it can be made of different materials such as plastic or metal, but the most common used is the one of copper. This device can last as long as 10 years as much, and a doctor must place it inside. Then we have the surgical sterilization. These ones can be applied both women and men. In men, is called the vasectomy. It consists of ligating and cutting the vas deferens of each testicle. In women, this sterilization consists of the ligature and section of both oviducts. In Spanish, this is called salpingoclasia. We also have the partial abstinence section of these anticonceptive methods. We first have the rhythm method. This one consists of the woman in having a regular menstrual cycle. This means that her period comes commonly the same days of the month for all the months, and this method consists of avoiding sexual relations 3 days before ovulation, the day of ovulation, and 3 days after ovulation.
I'm going to explain the chemical methods for birth control. There are hormonal methods which use hormones that modify the development of the ovarian follicles and inhibit ovulation. Although they are 100% effective if used correctly, however, a woman could have life-threatening risk factors if she consumes them. The most used hormonal methods are oral contraceptives. They are pills that contain synthetic estrogens and substances with similar function to progesterone. One pill should be taken daily. There are also emergency pills or the next day pills. These contain high levels of estrogen and progesterone that inhibit the production of these hormones by the ovaries. The use of these pills reduces the probability of pregnancy up to 75%. There are capsules with progestin that are implanted under the skin and make a slow and continuous release of hormones. They last for up to 5 years and are known as hormonal implants. Hormones can also be administered intramuscularly and depending on the formula of each medication. The application can be monthly or quarterly. The skin patches stick to the skin once a week for 3 weeks, skipping the 4 weeks so that menstruation occurs in this period. Another method is the vaginal ring, which releases estrogen and progesterone. It is placed at the bottom of the vagina for 3 weeks, and in the 4th week it is removed till menstruation happens. There are also spermicides that are drugs that yield sperm. They are available in creams, foams, and ointments, which are applied directly or with sponges that are inserted in the bottom of the vagina. There is also partial abstinence, and one of these methods is basal temperature method. During the ovulation, the body temperature increases and the quantity and consistency of the cervical mucus change. When these conditions are met, sexual relations should be avoided for up to 3 days.
Hi, my name is Sofia and I'm going to talk about 2 sexually transmitted infections. First, I'm going to talk about chlamydia. It's caused by the bacterium Chlamydia trachomatis and it is the STD with the highest prevalence, and at the beginning of the infection there are no symptoms. In man, it manifests as an inflammation of the utera accompanied by burning and clear discharge, as well as frequent and painful urination. In the case of women, up to 70% of those infected have no symptoms. However, it causes inflammation of the pelvis and abducts. If it is not treated, it can cause sterility. Now I'm going to talk about genital warts. As we know, are caused by human papilloma virus, which is sexually transmitted and it's not curable. Women infected with this virus have a very high risk of developing cancer in the cervix, and which is one of the principal mortality causes of women in Mexico.
Hi, I'm Maffer and I'm going to talk about the gonorrhea and the syphilis. Gonorrhea is a common bacterial infection that is easily cured with antibiotic medicine. It is sexually transmitted and most people with gonorrhea do not have symptoms. Gonorrhea is spread to vaginal, anal, and oral sex. The infection is carried in semen, pre-cum, and vaginal fluid. Gonorrhea can infect your penis, vagina, cervix, anus, urethra, and eyes, but that's rare. Syphilis is a bacterial infection that's usually caught by having sex with someone who's infected. Symptoms can include small, painless sores or ulcers that typically appear on the penis, vagina, or around the anus, but can occur in other places such as the mouth. It's usually treated with either an injection of antibiotics into your buttocks or a course of antibiotics tablets if you can have the injection. You should avoid any kind of sexual activity or close sexual contact with another person until at least 2 weeks after.
The follicular phase starts on the first day of menstruation and ends with ovulation. Prompted by the hypothalamus, the pituitary gland releases follicle-stimulating hormone FSH. During ovulation, the most mature egg is released from the follicle out of the ovary. Once the egg leaves your ovary, it moves through one of your fallopian tubes towards your uterus. The egg waits for a sperm cell around 24 hours before it dissolves.